September 2024, Marion County, North Carolina. The deadliest hurricane of the year is making landfall, and while people brace for flooding, power outages, and broken roads, what was not anticipated lay far beyond the shores. When Hurricane Helene made landfall, crisis became the condition of an entire region. Homes were destroyed, people were displaced, and far too many lives were lost. But in the slow journey to recovery, a crisis was underway all across the nation because of this natural disaster. Hundreds of miles away from the impact, hospitals in states like Texas, New York, California, and Arizona would begin rationing IV fluids. As the tide pulled back, a dark reality settled in, a reality that would have clinicians across the nation asking themselves which patients would receive IV therapy and which would not. Patients arriving for life-saving chemotherapy were told to hydrate at home. Emergency rooms began asking who could safely drink fluids so IVs could be reserved for those who were sicker. This wasn't because demand surged. This was because one manufacturing plant in the small county of Marion, North Carolina flooded, and the drug supply chain had no margin for failure. We don't expect this to happen. In a world full of advanced therapies and medical breakthroughs, the systems behind them should be stable and dependable. Yet, times like this reveal an uncomfortable truth. The sophistication of medicine doesn't guarantee the resilience of the systems that deliver it. In early 2024, the same year Hurricane Helene occurred, the United States experienced a record level of drug shortages, more than 300 at once. And while some might even say we have seen a decline in active shortages, the reality remains that they are still in the triple digits. So why does this keep happening? Because we still manage drug shortages as if the supply chain is a linear process, as if over-the-counter and life-saving medications move neatly from manufacturers to hospitals, and the supply chain is impacted only after it breaks. Yet, the consequences are too dire to continuously misunderstand the system, because ultimately, patients pay the price. The reality is, the drug supply chain is a fragile, interconnected ecosystem. An ecosystem that is yet to be fully mapped or explored. An ecosystem in uncharted territory. In this setting, our instinct is to fall back on what's familiar. And that's exactly what we do when drug shortages occur. We tell simple stories for a root cause. A manufacturing issue. Demand surged. Or it was a natural disaster. And then we do what feels efficient. Allocate what's left, substitute alternatives, and ask clinicians to conserve. Once the immediate crisis has ended, clinicians and patients are left with unanswered questions and the same dreaded answer: your medication is not available. But shortages continue happening, many times longer, broader, and more disruptive than before, which tells us something important. The problem isn't just what failed, it's how we're thinking about the system as a whole. I see this every day. I'm a pharmacist, and I work nationally on drug shortage response, often long before patients ever hear about it. And this vantage point revealed something to me that we rarely acknowledge. Ecosystems don't fail because of a single event. They fail when pressure builds across the connections we don't see. If you have ever taken a biology course, you learn that when one species is removed or a resource is stressed, the effects ripple outwards, often in ways no one can anticipate. The drug supply chain behaves the same way. When one manufacturing site goes offline, demand shifts, alternative strain, and raw materials tighten. Suddenly, the problem isn't just one drug, it's an entire class of therapies becoming unstable. Yet, our focus is almost always on the visible failure, and we manage drug shortages one product at a time. We ask, what's short? How much is left? What can we substitute? While these are necessary questions, they are not sufficient. They assume the system is predictable. But if there is one thing I've learned, it's that the drug supply chain is not. In today's healthcare environment, one headline or social media post can trigger panic buying, and suddenly, a single event can quietly become a single point of failure. These are systems behaviors that we have never fully mapped before, and when it comes to uncharted territory, the question is not about geography, it's about mindset. Simply put, we cannot solve ecosystem-level problems with linear thinking and temporarily gratifying solutions. We need a new lens, one that blends system sciences with human behavior. The goal is not to predict the next shortage, but more importantly, to understand why the system is fragile in the first place. So why does this matter? You don't have to be a pharmacist to care about this. Because when drug shortages occur, the consequences show up as delayed care, compromised outcomes, and inequities in healthcare access. However, this challenge also presents an opportunity. The drug supply chain is vast, underexplored, and in desperate need of innovation. Because someday, or maybe even now, you or a loved one may be at the receiving end of patient care, being delivered the news that your treatment is not available. Imagine your parent, grandparent, or sibling who relies on insulin simply to stay alive. Imagine being in the emergency department and being asked if you can safely drink fluids so IVs can be rationed for other patients. This is not theoretical. This is personal. It may sound intimidating, however, history tells us something different. That is, uncharted territory is where progress happens. It is the intersection where those willing to see and think about systems differently can make lasting change. The drug supply chain is not broken because it's mysterious. It's fragile because we have never fully mapped or explored its dependencies. So here's the shift we need to acknowledge. Drug shortages don't have to be a surprise. They can be a predictable outcome. We can see stress in the ecosystem before it ever even breaks. If we do this, we shift from a reactive approach that leverages mitigation at the exact point a drug goes short to proactively identifying gaps in areas of weakness in the supply chain before it ever even breaks. For decades, the healthcare system has optimized supply chains on cost savings alone. But cost savings without resiliency leads to fragility. So here's the question we need to stop asking. How do we fix drug shortages once they occur? And what we need to start asking is how do we start designing systems that hold under pressure so that we are not left navigating the fallout when they fail? As patients, as caregivers, as a society, we deserve the right to have access to a dependable and stable drug supply chain when we need it. Drug shortages are not just supply chain issues. They're signals telling us where the system is fragile in the first place. So let's dive into this world of uncharted territory, because the danger isn't in the unknown. It's in pretending that these failures don't exist in the first place. Thank you.